Ladies and gentlemen, councillors and members of the voluntary sector representatives, welcome this morning to the Voluntary Sector Liaison Committee on Thursday the 27th of November 2025. I'm Catherine Peters. I'm beginning the meeting this morning while we hand over to the new chair. So welcome to this multi-locational meeting of the Voluntary Sector Liaison Committee being held in the chamber at T Penarthur and via Microsoft Teams on Thursday the 27th of November 2025 at 10:30 a.m. This meeting is being live streamed and a recording will be made available to view via the Council's website, except for discussions involving confidential or exempt items. Therefore, the images and audio of those individuals present and or speaking will be publicly available to all via the recording on the Council's website. Members attending remotely, please leave your cameras on but mute your microphones. For those members attending in the chamber, please use the chamber microphones when you are called on to speak. Members and officers should only activate their microphone after the chair has invited them to speak on an item. There are no planned fire drills this morning. If the fire alarm sounds, please make your way to the fire exit at the rear of the chamber and follow Caerphilly Council staff. If you consider yourself to have a disability, please ensure that this is made known to a council staff member in attendance. Thank you. Okay, first item of the agenda this morning is to appoint a chair for the ensuing year. This ensuing year, the chair responsibilities fall to the voluntary sector representatives to appoint, and I understand that Laurie Jones is the agreed nomination. Do we have a mover and a seconder for that nomination, please?
Yes, I'll move that.
Thank you, Judith.
A second.
Thank you. And voting will be by a show of hands. Please use the hands up function in Teams if you're attending, or on Teams if you're attending remotely, or raise your hand if you're in the chamber. Okay, passed. And thank you. Please lower your hands, and please lower your hands on Teams as well. Laurie Jones has been appointed as the chair of the Voluntary Sector Liaison Committee for the ensuing year. I will now hand over to the rest of the meeting to her.
Diolch yn fawr, Kath. Thank you very much, everybody. If we can move then to item 2, which is to appoint a vice chair for the ensuing year. And I understand that Councillor Marina Shacon-Dawson is the County Borough Council nomination for vice chair of the Voluntary Sector Liaison Committee for the ensuing year. So do we have a mover and a seconder for that nomination, please?
I move. Okay.
Yeah, seconded.
Seconded.
Yeah, did we get those? Yeah, great, thank you. So voting will be taken by a show of hands. Please use the hands up function on Teams if you're attending remotely, or raise your hand if you're in the chamber. All those in favour, please indicate now by raising your hand. Okay, so please lower your hands, and all those against, please raise your hand. Any abstentions, please raise your hand. Okay, and I'll just ask the committee clerk to confirm that vote. Great, thank you. So Councillor Marina Shacon-Dawson has been appointed as Vice Chair of the Voluntary Sector Liaison Committee for the ensuing year. If we can move to item 3 then, to receive apologies for absence. And if you could please record any apologies in the meeting chat or advise committee services. Okay. And item 4, declarations of interest. Councillors and officers are reminded of their personal responsibility to declare any personal and or prejudicial interests in respect of any item of business on this agenda in accordance with the Local Government Act 2000, the Council's Constitution and the Code of Conduct for both councillors and officers. Are there any declarations of interest? No. Okay, thank you. And we'll move to item 5, which is to consider the minutes of the Voluntary Sector Liaison Committee, which was held on the 13th of March 2025. We will consider the minutes for accuracy, and then I will ask for somebody to move and second them as a true account. Councillor Priest, did you want to come in?
Yes, you can, Chair. Sorry to have left it like it was, but I had to go to the room. As Councillor Whitcomb, Andrew Whitcomb, is a policy been put through?
He's not on this committee, so...
He's not on that committee. Originally he was. That's all. I just start checking. Right, fine. Thank you for that, Chair.
Okay, thank you. So if we can have a look at the minutes and consider them for accuracy, a page at a time. So if we can have a look at page 1. Page 2. Page 3. And lastly, page 4. Okay, can I ask for somebody to move the minutes as a correct record?
I'll move the minutes.
Thank you. And somebody to second the minutes?
I'll second.
Thank you. Members having been moved and seconded, we will move to the vote. All those in favour, please indicate now by raising your hand. Okay, please lower your hands. All those against, please raise your hand. Okay, please lower your hand. Any abstentions, please raise your hand. Okay, and the vote has been confirmed by the committee clerk. Okay, if we can take any matters arising within those minutes, are there any matters arising that anybody wanted to raise? No, I can't see any hands. Okay, thank you. And we'll move on to item 7 then, which is the Caerphilly Compact update. And I'll now hand over to Steve Tiley for that update. Thank you.
Thank you very much, Chair. So it's probably just a bit worth giving a bit of a background to where the compact is and where it sits at the moment. And it starts really with the work that's been happening around the third sector partnership agreement. So back, it must have been about a year or so ago now, there was a kind of conversation at the Gwent Public Service Board about putting in a third sector partnership agreement for Gwent. And basically that is a set of principles and guidelines for joint working between public services, partners and the third sector. Now, if we go back in, even further than that, there was varying different type of agreements that were in place before the Gwent Public Service Board come into play. There was a compact within Caerphilly, and there wasn't necessarily other compacts across the rest of Wales, but there was a signed one in Caerphilly, which was really useful for us in actually devising the new third sector partnership agreement. And it is actually a bit of a directive from Welsh Government for us to have these. So, we were really ahead of the curve on that. What it basically covers is it covers about what the responsibilities are for partners with the third sector. It also includes the Welsh Funding Code of Practice. It discusses about payment terms in the unfortunate event where there might be a conclusion in partnerships, how that's done in a sensible and productive way as possible. There's about projects and services, so how we can work together with the third sector around the complexities around some of the work that's going on in the region and how the third sector can get involved. It gives an understanding about tender obligations and also about monitoring and reporting and conflict resolution too. Now, the third sector partnership agreement is in iteration at the moment. It has gone through the Gwent Public Service Board and a draft has been agreed there. What the next purpose really is for us now is to discuss some of the appendices to that, which are the compacts, which I'm going to discuss a little bit about where Caerphilly's is today. So the compact itself, they are very important to the wellbeing plan. It's about kind of having an agreed way of working within Caerphilly, and that's what we're doing at the moment. Basically, each region will have one of these compacts. We're currently working with the 4 regions that we work with, so Blaenau, Gwent, Caerphilly, Monmouthshire and Newport. There's conversations as well also happening within Torfaen. And as I said, these appendices will sit underneath that third sector partnership agreement. The way we are with Caerphilly is that we've been having discussions with local authority, we're having discussions with the third sector representatives as well about how that structure can work as we move forward. It's looking about how we can get engaged more in regards to the wellbeing plans for the area and where the third sector can sit within those. It's looking at as well making sure that in regards to the actual third sector partnership agreement itself, there has been a change to the Welsh Government funding code of practice. So we do need to take that third sector partnership agreement back through the Gwent Public Service Board. So there's a piece of work that we need to do with that. But ultimately, we're hoping to have this overarching agreement now in the next few months, especially with each of the different regions in which we're working within. So, like I say, within Caerphilly, we are having a conversation with the local authority. They will need to go through the various processes. So we're having a conversation with the voluntary sector reps next week about how the structures may look. We will probably bring it back through to the liaison committee when something is agreed there. We'll also be bringing it through to the various forums and also with any discussions where anyone would like us to come and discuss the compact as well. I'm more than happy to do that once we've got something written down and in place. So that's it really in a nutshell. I think if anyone's got any questions, I'm more than happy to touch on, give any answers to that. But yeah, over to you, Chair. Thank you.
Thanks, Steve. Does anybody have any questions? If they can raise their hand on Teams. No. Okay, as Steve said, there will be opportunities over the coming weeks now and in the new year as well to have further updates and also feed into some of those developments as well. Okay, thank you. If we can move on to item 8 then, which is the fast track briefing, and if I can introduce Alex Porter, who's going to provide a presentation for us. Thank you.
Good morning. I'm really sorry. I'm having technology problems. I'm just trying to get my laptop to work. I'm just on my iPad. Give me a second. I did send my presentation across. I don't suppose it's made its way to somebody who can load it for me. Otherwise, I'll try and load it off my iPad.
We're just checking now, but I'm not sure.
I sent it to Heather Pels, but I don't know whether that went any further. So
we're just checking now.
Okay, thank you. In the meantime, I'll see if it'll let me run it off the iPad.
Okay. We're just checking. Are you able to screen share, Alex, anyway?
Yeah, I should think so. It's just because it's Apple, it doesn't like Microsoft technology. So
okay.
It might not look as I want it to, but it should be sufficient. So let's do that.
Okay, thank you.
No. Okay, can everybody see that?
Yes, yeah, that's come through. Okay.
So it's not going to look like a traditional presentation, but it'll get the point across at least. So apologies for that technology failure as usual. Yes, my name is Alex Porter. I'm a development worker for Fast Track Gwent, which to give a little bit of background, because I'm not sure where people's understanding are, is we are part of a bigger national group called Fast Track Cymru. Now, Fast Track Cymru, in its known state, has only been around for a couple of years, but actually started as part of the Fast Track Cities initiative in Cardiff and Vale in 2019, just before COVID, basically. And Fast Track Cities is a global initiative to try and meet the UNAIDS targets of 95% of people living with HIV diagnosed, 95% of people diagnosed with HIV on treatment, and 95% of people on treatment having an undetectable, untransmittable viral load. So what does that mean in the grand scheme of things? Well, what we're trying to achieve essentially is the sort of eradication of the disease as much as possible. What we're looking at is trying to figure out what will work in different regions in order to get awareness around HIV more, get the understanding higher, get the education higher, and making sure that people know what services are accessible for them in order to look after themselves. There's a lot of stigma, as I'm sure you're aware, around HIV, and a lot of taboo around sexual health in general. So a lot of what we try and do is challenge that stigma and re-educate people around sexual health in general. So as you can see, now we are bigger and better, shall we say. So we started as Fast Track Cymru about 3 years ago now. It was an initiative set up by the Welsh Government in order to try and get a national goal to ending HIV transmissions. And the way that we did this, because of the way that Wales is organised in regards to health boards, is we broke it down to regions and down to those individual health boards. But the success of those regions isn't a health board matter, it's a partnership matter. So we have people from local authority, we have people from NHS, people from third sector, people who are living with HIV. We've got such a diverse mixture of people in those groups in order to give us the best awareness around how we can tackle things. Part of that then is also assessing and deciding what actually will work for those areas. Now in Gwent, it initially started off as Fast Track Newport, but I'm pleased to say in the last year we've grown so big that we're now Gwent and we're covering all of those areas, and we do have representation from every council on our steering group, like I said, along with other third sectors, some NHS workers, community groups, all sorts of people. I'm proud to say that Gwent is a thriving group when it comes to ensuring HIV and trying to help with re-education. Now, when we assess, when we come together as a region, we decide what works for us and what we need to do in order to help get things progressed. And in Gwent, we decided that actually the best way to do that is to look at testing, make sure people are testing, look at stigma, challenge stigma, and also look at underserved populations, as we felt that those were the areas that certain people would not necessarily be being found. The LGBTQ plus community is very well versed in HIV and sexual health in general, but actually there are other places where we might not be doing so well, and where those communities, for whatever reason, are not engaging with that. So how does this work in the grand scheme of things with Fast Track Cymru, and how do they play into each other? Because on a regional basis, like I said, you sort of decide for yourselves what is important, but on a national level, Fast Track Cymru is answerable to the Welsh Government, but it's also a charity, and obviously part of what we're trying to do is help make the region's job easier. So we do lots of campaigning, we do lots of production of sort of assets and things like that, so people have got things to spread, to try and help re-educate with. We do leaflets, we've got campaigns. You might have been in contact with the HIV testing week in the last week, which was a massive success in Gwent, and due to the hard work of certain individuals, the scope of that was over 1 million people were reached in that time frame. So we're always looking to do and to produce things that will obviously enhance what we're trying to do and inform the general public as much as possible. In Caerphilly itself, we've had some big successes, well done to Heather Pels, because she's really worked to make sure that testing is accessible. You can get them from numerous places around Caerphilly. You can also, the awareness, she's making sure that different leaflets and things like that are around. So we're definitely spreading the word, as it were. So this is just some basic knowledge. So what we find in a lot of the time with HIV is that it is essentially people are not having the education hasn't changed since the sort of late 80s, early 90s, and things have changed a lot. I do a lot of community events where I chat to people, chat to the community, and the questions I get asked are shocking, but also not really. You know, one example of that is, can I get HIV from a toilet seat? You know, in 2025, I got asked that question, and obviously it's false. And a lot of these stigmatizing sort of beliefs are obviously just being carried on because there's no re-education around them. So one here, which some people might not know, HIV can be transmitted from birth parent to child, true or false. So vertical transmission is a thing. You can pass it from mum to baby, but in the UK we have HIV screening as an antenatal check. So the HIV will be caught and under control before they even give birth. And essentially in the UK, the only way of catching or transmitting HIV is through sexual intercourse, because we have such stringent mechanisms in place to ensure it doesn't happen anywhere else. And from an IV drug use, the chances of you getting HIV from that are so slim, because as soon as the blood of somebody with HIV leaves the body, and that's assuming that they're infectious to begin with, it dies. It can't survive outside the body. So we're really focusing on that sexual health element, because that is where the transmissions are taking place. So just to give you a bit of a global and sort of more local picture of HIV, a lot of this is quite out of date because we're working always with out of date data, sadly, and hopefully, obviously, as things progress, we will get increased numbers, but better numbers. But we know what we're working with at the moment. So globally, obviously, there are 1.3 new HIV infections in 2023. Now, this there are obviously certain areas that it's more prevalent, but we're still seeing transmissions in our country. So therefore, we know there's work to be done. So looking at HIV data specifically to the UK. Now, sadly, we don't have just Welsh data. It always gets sort of lumped in with England, but obviously it can give you an idea there of what the numbers we're looking for. And we do have more local data, but it's not available to be disseminated fully yet. So we're just looking to get the okay on that. But as you can see, the diagnosis numbers are sort of damning. They are still there. There is still a high population of men and women getting HIV, which is another thing that we don't. I had a woman say to me a little while ago, "Oh, I don't need to worry about that because I'm a woman," So these misconceptions are still prevalent. And when it comes to sexuality, actually, what we're looking at is heterosexual relationships are becoming more prevalent as a method of transmitting HIV. So just some little extra data. I mean, as you would expect, the more populous places are where there's higher number of diagnoses, but we're still getting these hotspots basically where there is significant transmission, and they're not necessarily in the cities. So it's interesting to see that things aren't changing necessarily in those underserved populations that possibly I was discussing earlier. So when it comes to HIV, what are we looking at? We're looking at stopping the infection before it can take over, treatment of the infection, and then possibly what we do if we think we've got it. So PrEP is a really great medication that a lot of people have never even heard of, and that is a tablet which specifically stops you getting HIV. Doesn't stop anything else, so you do still need a condom, but nonetheless it stops HIV, which obviously is great. And in Wales we have really good access. In England, they can be waiting months to get it, but in Wales, if you ring your clinic tomorrow, you'll get an appointment for next week. We're really good on that. ART is the treatment that they use for if you've got HIV, but the progression in that is amazing. 10, 20 years ago, people with HIV would have been taking 20 pills a day probably. Now it's 1 or 2 pills a day, and for some people it's actually an injection which they just have once every 2 months. So things have progressed massively. And for those people who are on medication and they've been on for at least 6 months, then we're looking at an untransmittable viral load. So they could have unprotected sex and they would not pass HIV on. We're trying to push forward this idea of U equals U, untransmittable. Sorry, my brain's just stopped. Undetectable equals untransmittable. So if you have an undetectable viral load, then you cannot pass it on. The last thing on there then is PEP. So PEP is something that if you have had unprotected sex and you're concerned about your risk of HIV, you can get PEP within the first 72 hours, and you can get that from your local clinic or you can get that from A&E as well. So how are we doing in Wales? So like I said, we're in Gwent specifically, we're doing great on testing. We're making sure it's really accessible for people, but we know there are still people who are not testing, and obviously it's really accessible. So a lot of people don't realise there's a test and post system in Wales. This was put in place by Public Health Wales during COVID, when there was a massive STI boom because all the clinics were closed. But strangely enough, not being in contact with people during COVID still meant people went and had sex. So you can access the test and post system online. It gets delivered to your house. It's a packet. You do the test yourself. You send it back, and then they text you results. So it's really easy. And what we're doing now in Gwent really well is getting these tests made into community packs where people can just go somewhere and collect them, and they don't even have to have a postal address. They just need the correct phone number, in which case they can have their test results texted to them. So I've touched on this briefly. Stigma is sort of intrinsic to everything we do, because there's so much stigma around HIV and sexual health in general. So it's always part of what we're thinking when we do things like this, in order to try and break down that stigma and chat to people. So I'm not sure of time, so I don't want to dwell on this too much, but these are just some stories that over the last few years of doing this job I've come across, and there are a lot of them are from Gwent, so it is well, they were all from Gwent, so it does say a lot. So obviously none of these names are real, but the stories are. So Sarah, she was diagnosed with HIV during those antenatal checks that I mentioned at 19 years old. She thinks she was infected during a period of her life where she was trafficked as a young teenager, and the diagnosis of the HIV brings forward a lot of trauma from that period in her life. Obviously, that in itself was a traumatic diagnosis. It changed her life in a lot of ways. She very gratefully gave birth to a little boy who was and she did not pass HIV on to him, which she's always grateful for. But one day she's dropping a young boy off to school, only to find that another parent or group of parents stop her getting into the school. They've been speaking to the headmaster about getting her banned from the school, as they found out through gossip at the local GP surgery that she has HIV, and now they're concerned about they're concerned about the safety of their children. Obviously, there's so much to be challenged here. There's nothing that that Sarah is going to be able to do to those kids, but their beliefs have made this woman's life hell. Simple as that. And it did get resolved, but it doesn't mean that her life was any easier as a result. Then John basically is part of the LGBT community. As I said, generally very well versed in sexual health, the LGBTQ+ community. But he's been utilising PrEP for a long time. Now, the thing with PrEP is that you need to renew your prescription, and it's not as simple as just picking it up from the pharmacy. You do need to see the clinic. They do blood tests, and it is more than just a simple appointment. He let it lapse as a result, and he then consequently contracted HIV. And he always knew that he could actually do something about that, but he stopped using PrEP and therefore caught it. And obviously there's an element of guilt for that. So finally, last one, this lady, Diane, she is a white heterosexual woman in her early 60s. She's been having recurring chest infections for over a year. After 18 months of illness, a GP requested a HIV test, which came back positive. When I was chatting to this lady, she was quite upset about the fact that she felt if she'd been a black woman, potentially, then they may have done that test a lot earlier. There was her friend who is a black woman, only had a month of chest infection before they tested her for a HIV. Obviously, you don't know what the situation is in those GP surgeries, but I think a lot of our misconceptions around HIV obviously can have poor negative health repercussions for our patients or for the patients. So that's my little case study. So this is just information then about me and our group. So and how you can be involved. So we've got the steering group, which meets monthly, which is usually on Wednesday, basically. We've just had ours yesterday. You can also then just, if you want to just stay aware of what we're doing, you can join our mailing list or all our social medias. And we're on Instagram, LinkedIn and Facebook. And you can always just contact me if you want any further training, any information, any leaflets. I am a yes person, so whatever you fancy, just let me know. And I will stop broadcasting.
Thank you, Alex, and thanks for such a detailed and informative presentation. I'm just going to ask if anybody has any questions. Yeah, Councillor Heron.
Hi, that was really interesting. I'm so glad that I'm here listening to this. I will be honest, it is really important. It's incredible about the medication that they take. I want to know, and you may not be able to answer this, but I know I'm on medication for life. If I forget to take it, I've gone 3 or 4 days. So if they take 3 or 4 days, if they miss it 3 or 4 days, can this have an impact on their well-being? Thank you.
No problem. So the short answer, thank you for the question, Teresa. Yeah, no, essentially, if you miss 1 day of medication, it's not going to have a catastrophic event. You know, the clinics would advise, because I'm not a clinician, but what they would advise is if you were concerned, if you'd missed a dose of your medication and you were having set intercourse, they would probably recommend you use a condom just to be on the safe side. But the reality is a couple of days is not going to make a big difference as long as you then get back on track. The sad thing about medication a lot of the time is there is a lot of mental health around them taking their tablets. So if they've missed 1 dose, if they missed 1 dose because they've forgotten, or if they missed that dose because they want some sort of control over their lives. So it's difficult sometimes to understand what's happened there. But if it's just a matter of I've forgotten my tablet 1 day, don't worry, just take it the next day.
Thank you for that. Will you be sharing the slides as well, please?
Yes, no problem, I can do that.
Brilliant, thank you.
Thank you both. If I can bring Rob Heaton-Jones in next.
Thank you, Chair. Thank you, Alex. That was really helpful, and I didn't appreciate how much work was going on. I've got 3 very questions, if I may put them. First of all, are there any side effects on the medication that certain people can't take them, or is the medication fairly robust on that score? And
so sorry,
go on.
I was going to say, so basically there are a number of different tablets essentially that people can go on to, and they may not get on with some, but they will get on with others. So that's part of the process, is then figuring out what tablet works for them. Some of them can make people quite sick, basically, but there are other alternatives, and that's what when somebody is newly diagnosed, that will be something the clinic will go through with them.
Oh, that's really helpful. Thanks for clarifying that. 2 other questions. How is this fantastic initiative able to support the prison population and also substance misusers in relation to the generation who have dabbling into illegal drugs?
Yeah, no, great question. So, I'm pleased to be able to answer them, to be honest with you. So, in regards to the drug and alcohol sort of misuse service, so GDAS are actually involved with are on our steering group. So they are already part of what we're doing. So we're already we're partnered with them in quite a lot of things, especially in Gwent. We actually just ran some awareness events where they did drive blood spot testing as well. So obviously we're sort of in those spaces. You know, a lot of, as I'm sure you can understand, you know, we're not a big group, and it's all about not trying to duplicate what other people are doing. So because we're partnered with GDAS, we in a great way, we can give them bits that they can then give us bits, and we can work together on certain things. So that's sort of the limitation to what we can do with that, because obviously they were already in those spaces. It would be pointless for us then duplicate it. In regards to prison service, that has been a more difficult nut to crack, I will say. So with the probation service, we're doing really well. We've got testing within the probation service, and they've got all our leaflets and things like that in Gwent. So that's obviously great. But in the prisons themselves, it's been a little bit more difficult, because they don't. The prisons have their own method of testing and things, basically. So we have tried to go in and do a bit more, but we would definitely be willing to, if we can get in with them and do more events, that would be great. But there's a lot more, obviously, security and things like that. But education around the staff is something I've been really keen to try and implement. So we haven't quite got there yet, but it's definitely in the plan.
All right. Thank you, Alex. That's been very helpful to understand that. Thank you.
Thank you both. Judith Pritchard.
Yes, pardon my ignorance, but the last case study, Diane, was a white cis CIS woman. What's CIS?
Oh, so cis just means was born a woman and is still a woman. So it's just a term for somebody who is the gender that they were born with.
Oh, so there has to be a special designation for it, does there?
It's just a way of ensuring that obviously there's clarity. It's not something that I've, invented. It's just something that's becoming quite sort of a general vernacular for certain things. And obviously I think the difficulty is with HIV, a lot of people assume a lot of the time that it's it's LGBTQ plus people. So, they might say, oh, I bet she's not actually a heterosexual born woman, because surely a heterosexual born woman couldn't behave that way. But obviously so it's just about making sure that there's clarity.
Thank you.
Thank you. And Councillor Shacon Dawson wants to ask a question as well.
Thanks. I just wanted to ask, do you train community groups, and have you had much interest from community groups?
I mean, the short answer is yes, I do training. It's not a formal, we don't give a certificate at the end necessarily, no. But things like this where we've got presentations which are a bit more detailed and give a bit more specific information. So yes, we do that. We've done some, but it's definitely something we're looking to do more of. It's just about getting the interest.
Yeah, and it helped end stigma as well if people were more...
Exactly.
Okay, thanks.
Thank you. Any more questions before we move to the next item? No? Okay, thanks again, Alex. And if we can share the presentation, there's quite a large network of organisations that we can share that with as well. So thank you very much.
Fantastic. Thanks very much, all.
Great, thank you. If we can move to item 9 now, which is the grants awarded via the grants to the Voluntary Sector Fund and the Welsh Church Acts Fund. And I'm going to hand over to Vicky Doyle, who will introduce the report. Thank you.
Thank you, Chair. Good morning. So this report summarises activity and grants awarded under the Grants to the Voluntary Sector Fund and the Welsh Church Acts Fund between the 1st of April and the 31st of October this year. So the budget's available for each grant. So for the Grants of Voluntary Sector Fund, it's listed in 5.2 in the report. So our budget for the current year is 8,910. We had a carry forward budget from last year of 9,531, which gives a total budget available of 18,441. In 5.2.2, you can see that we've awarded a total of 13,383 between the 1st of April and the 31st of October to 34 either voluntary organisations or individuals representing Wales or GB at sport. So you can see the list there of what has been supported. And then moving on to the Welsh Church Fund. Sorry, just scrolling through. So in 5.3, you can see the budget for this year is a total of 77,676.78. That includes a budget of 66,673 from Monmouthshire County Council, which is our annual allocation. There was an amount of 3,503.78 held in CCPC accounts from previous years. And then we had one project which was approved prior to the current year that came back in because the applicant was unable to secure their match funding of 7,500. So as I said, a total of 77,676.78. Between the 1st of April and the 31st of October, we've approved 19 projects, totaling 76,561.87. So effectively, the budget is used now for the current financial year. And you can see in 5.3.3 the list of projects that have been supported via the Welsh Church Fund in the current year. We will have a new allocation for the Welsh Church Fund from the 1st of April, but effectively now that grant scheme is closed for the rest of the year because we've allocated all the funding available.
Thank you, Vicky. Does anybody have any questions regarding the report? Yeah, Councillor Broughton. I think you're on mute. There we go.
Yeah. For the Welsh Church Funds, has there got to be match funding, or can some groups just get the grant for, say, 5,000?
So they can get 100% grant. They wouldn't get the 5,000 automatically. It would depend on, the project cost, what they wanted to do. But they can get up to 100% funding for whatever project it is they want to do. Some organisations do provide match funding from other sources, but it depends on the circumstances of, the group and the project.
Right, thank you.
And Judith Pritchard, would you like to ask a question?
Thank you. Yes, I realised that the maximum amount under the Welsh Church Fund is now down to 5,000 because the 7,500 was because we had an underspend before. In view of the fact that it's 5,000 now, which is not an awful lot of money, are we still asking for leases? Because this can hold things up very considerably. And I understand that we're the only authority that actually ask for a lease. Thank you.
Yes, we have obviously discussed this a number of times previously. It is in the guidance that an organisation has a lease, but that's only if they are doing structural work to the building. If it's for things like equipment or, items to go in a building, then they wouldn't need a lease. But obviously, if it's structural work to the building itself, then we would require a lease in order to apply for a grant.
Thank you. Any further questions? Joanne Price?
Yeah, I understand that the spend is spent now this year. Will there be funding available next year?
Yeah, as I said previously, we get an allocation of around 60,000 a year from via Monmouthshire County Council, which comes from the dissolution of the Church in Wales. It does vary. As I said, this year it's 66,000. It all depends on how that kind of investment fund is performing. But we sort of account or say around 60,000, but it does vary. It can be slightly more, slightly less. But it's usually around that figure.
Thank you.
Okay, thank you everybody. Unless there's any further questions, just to note the recommendation is at 3.1 of the report as follows, that members of the Voluntary Sector Liaison Committee note the applications received that meet the criteria for the grants to the Voluntary Sector Fund and the Welsh Church Act Fund, which have already been approved by the Head of Financial Services and the S151 officer under delegated powers, and which are reported to the Voluntary Sector Liaison Committee for information. And that recommendation has been noted. And that concludes the meeting today. If I could thank everybody for attending this morning's Voluntary Sector Liaison Committee. Diolch yn fawr I bawb am fynychu bore yma, and I declare the meeting closed. The webcast will be stopped, and members attending Penalty House, can I ask you to remain seated until the webcast has ended, and members attending remotely, you may now hang up.